En esta oportunidad estamos aquí presentes con el doctor Jay Lindenthal. Él es el jefe de programa de salud pública de la Universidad de Rutgers, New Jersey Medical School. We want to know, and the university wants to know, the students, what type of work do you do in your hospital, or is administrative, or is clinical?
Well, I do not do any, I'm not a clinician, but I have been for many years a professor of psychiatry, and I created at Newark what is called a MiniMed School. A MiniMed School, there are 70 such programs in the United States of America, and they are dedicated to educating the public about health and medicine. So we're now beginning our 16th year, and we've had well over 8,000 people from the public who have spent 8 weeks, one night a week, including some weekends, studying medicine and health. And we give them the same lectures that we give the regular medical students, and we rely very heavily on our medical students to help the faculty teach people in the public. It is at a very high standard, and we're very happy with the results of what we see. And one of our programs involves our good friends here in Huancayo, and that's what we're here for. This program involves 8 students, sometimes 10 students, who come to Huancayo during the course of the summer in groups of 4 or 5 for a 4-week period of time. And we have great assistance, enormously wonderful assistance from Chusihuanca, and of course our friends, Dr. Calderon and others on this faculty who assist us in giving our students the best possible experience that they can have in this emerging world environment. And every student who has ever taken part in this has come back and praised the work of our friends here, the faculties of various schools here and the hospitals. And we've been absolutely delighted with the cooperation that we have received over the years. And as a sort of thank you to our wonderful friends over the years, about 8 or 10 faculty members come for 1 week, and we consult with our friends here, and we deliver lectures here on this in Huancayo, and we consult with our friends. And one of the issues that we are very happy with what we're beginning to develop a very strong, powerful relationship in the area of research with Dr. Calderon, the dean of our medical school here, and with the St. Joseph's Hospital in Paterson, New Jersey. Now, many of us were not, we certainly didn't know until recently that a town called Paterson, New Jersey, which is about 15 miles from Newark, where we are located, has the highest number of Peruvians in the United States of America. And obviously they've immigrated from here in Peru, and many of them from Huancayo have come to Paterson. And we think that there is enormous possibility for serious research, especially as it relates to the relationship between high altitude and migration and how that may affect various diseases. For example, strokes. We're very interested in strokes, and we're interested in neonatology, the course of early child development, and of course any other issues that our good friends here are interested in. We hope to start what's called a prospective study, whereby we will be gathering data here, and we will be gathering data from among Peruvians in Paterson, New Jersey, and we will begin to develop some kind of insights that are crucially important, not only to our friends here, but also to our Peruvian folks in the United States and to the rest of the medical world. So we're very optimistic about the future. Yes.
Okay, that will be great to work together to compare what's going on with our patients and what's the difference with the high altitude and the patients who live in the United States, and if there are different risk factors.
Correct. Yes. Well, that's what we're very much hoping to begin. We are not naive. We completely understand that these are complicated issues, but we are very happy to be joining our friends here because clearly the level of sophistication is just marvelous, and we think we can work very well together with our new friends here. Yes.
Okay, thanks. You were telling me yesterday about MiniMed.
Yes.
That you started MiniMed and it's like a boom, like
Yes.
it has been copied by other faculties.
Correct. Yes. We're working with, we're beginning work with, first of all, let me tell you that we are widely copied in the United States for the kinds of things that we do. For example, we have a program for prisoners where our medical students go to the prisons and actually lecture to people who are in prisons. And we go into homes for abused women and pregnant adolescents and others. In other words, what we try to do is to expose our medical students to as many different environments that they will need to deal with as they enter the field of medicine. The field obviously has changed dramatically. People in medicine don't necessarily have the choices of where and they can practice, and they have to be prepared to deal with a variety of populations. And we are our program, and we have other programs at the Rutgers, New Jersey Medical School, and my colleagues are very dedicated to helping our students arm them so that they can in the future go out and deal effectively with a broad range of individuals from various origins, etc. Yes. So that's the MiniMed School, as I say, is one of the programs, and we're very gratified because it has been a huge success.
I want to ask you, every year students from New Jersey Medical School come here.
Yes.
And I want to know what are their commentaries or about their experiences. You told me that there's a special selection for them.
Oh, absolutely. Let me make it clear. The students who ultimately come here, there are about, I would have to say, about 40 of them, maybe 50, who express an interest in coming here. And they are interviewed several times until by the preceding group, those who have been here and know about our friends here and what's involved. And they are chosen. Those who come here have already been selected by those who have been here previously to come. So it's just, you can't just walk into this program. We try to make sure that the students who come here are very dedicated and very interested in coming. And so far it has worked out very well. We are enormously grateful to you for giving the kinds of experiences that you do for our medical students. It entirely enriches their experience. They come back and everybody knows, oh, if I could only get to Huancayo, I would love to go. And they all know about it now. And so that's thanks to you. It's very thanks to you that all the help that we do get from you, and we hope to continue this on not only the research, of course, but also this educational component that we've been developing over the years. These things take time, and by what we're seeing here last year, this year, so we're hoping we're very optimistic about the future.
Oh, that will be very important. Finally, we want to if you can give some words for the students, the medical students, according from your experience, what does a doctor means to you, and how they can receive this motivation to continue their studies, to finally get a medical degree. So this, here, this interview is being seen by the medical students.
I see.
Yeah, so we want to ask you for a message for them. What does it mean for you to be a doctor, and what do they have to expect? How you can motivate them to continue with their studies?
We think, if I understand your question correctly, being a physician today is an enormously complicated situation involving, as our distinguished Dean of Admission continues to mention, his name is Dr. Heinrich, it requires an enormous amount of passion and dedication. And what we see over here, the problems going through the hospital, for example, this morning we went through salud. We see the complicated problems that you see, and the new diseases that you are discovering once you admit people for some prior disease, and all of a sudden you find yourself with all kinds of many different challenges. Well, we think that this is what medicine is all about, and we're delighted that our medical students are able to go on rounds with you and spend X number of hours and see just what's involved. And we are also very happy to, we tell them that we hope that they will be helping their fellow students here learn more English terms as it results to medical concepts and constructs. And we also we hope to learn more Spanish, because that's incredibly important for us here in Newark, New Jersey, and throughout the United States. I mean, Spanish is spoken by increasing numbers of individuals, and so whatever our students can learn from you, we're enormously gratified by it. So the point is that when our medical students get back to the United States, they have seen a great deal, and this is what we want. They've been exposed to many, many challenges in medicine in the 4 weeks that each group has. And we believe firmly, in large part because of you nice folks, that we produce a more prepared, a better prepared physician than we otherwise could. So we are very grateful to you, and we want you to know that we're grateful for everything that you do for our medical students. And they come back enormously delighted with this experience. Now, of course, we have to reassure, myself and my colleagues, we have to make sure that whatever experience they have, that we can, that they've done X number of hours of rounding, let's say, and they've done so many hours, let's say, in some of the HIV orphanages, or they've done so many hours of, let's say, teaching and studying Spanish and English, et cetera. We'll need to more or less quantify this over time, but those are things that we're very reassured that we'll be able to manage that. You bet.
Okay, Dr. Lindenthal, we are also very grateful with you, and because you come here and you share your experiences and your lectures here,
Yes,
and we also learn a lot of you.